My name is Mackenzie Milburn, and I'm a family nurse practitioner student at West Texas A&M University. Today, I'm going to be presenting on identifying human sex trafficking in a primary care setting. The reason why I chose this presentation is because I'm currently a registered nurse in an emergency center in Lubbock, Texas, and I've encountered a few victims of sex trafficking, and as a brand new nurse encountering them, I had no idea how to respond or react or what to even do for these victims. So I thought that it was a good education topic that I could discuss today. To start off, human trafficking is also referred to as modern-day slavery. It's a crime that affects the entire globe. Its prevalence has been made very apparent in the state of Texas over the last several years as the number of victims continues to rise. Sexual exploitation is the focus of this presentation and is just one of the many industries that human trafficking encompasses. Healthcare providers have a very unique opportunity to provide aid to victims of sex trafficking through medical visits. We can raise awareness and educate healthcare providers on red flags and indicators of sex trafficking to begin you the steps of the process to end sex trafficking forever. So the definition of sex trafficking is defined by the United States Department of Homeland Security as modern slavery. Human trafficking is the recruitment, transportation, transfer, or harboring of humans for the purpose of forced labor. It is present in every nation around the globe, and it does not discriminate against the level of economic development within that country. So it's obviously prevalent in the richest country of the world, which is the United States of America, and its prevalence is even larger in smaller countries that aren't as economically advantaged as we are. There's several different industries that are involved in human trafficking. These include, but are not limited to, agriculture, manufacturing, hospitality, healthcare, domestic service, and commercial sexual exploitation, which is the topic that we're primarily going to be discussing today. Sex trafficking is defined as human trafficking for the purpose of sexual exploitation. Women, men, and children are affected. It does not discriminate against gender. That is something that is very important to remember because a majority of the studies available do focus on women survivors. The reason being, men aren't as likely to come forward and they're not as likely to fall victim to sex trafficking, but it is important to note that it can happen in any gender. There are several risk factors involved in sex trafficking. Traffickers usually like to prey on those of young age, so anyone between the age of 12 and 16. This is a very young and impressionable age to be at. Those that are disabled or lack education, those that lack familial support, and the marginalized. So this group includes LGBTQ community, runaways, and those who have actually aged out of the foster system and become too old to live with foster families, and undocumented migrant workers. One of the biggest questions that people ask is where might I encounter these victims? There are several different places in the healthcare field, and it does not really discriminate against that either. So you're not just going to see them one place or the other. You're going to see them in emergency departments, community health clinics, primary care settings, public health departments, and health planning clinics. So there's several different areas where you might encounter these victims. I'm going to discuss the prevalence of sex trafficking. There's going to be a lot of numbers thrown out there, which isn't as important as just understanding that it is very prevalent in the state of Texas and our entire globe. So because of the illegal nature of sex trafficking, it's very difficult to obtain reliable exact figures, which isn't surprising, but there's a lot of studies and research that have been done recently on it, and it is estimated that 25 million people are victims of human trafficking worldwide. 4.8 million of the 25 million are forced sexual exploitation, so they're actually involved in sex trafficking. It is estimated that women make up about 71% of this total, so they do make up a large portion, but you've got to remember the other 29%. Those are males. That is also a much larger portion of males than I would have ever thought would be involved in something like this. It is estimated that 313,000 victims of human trafficking are located in Texas. That is a little over the size of Lubbock, Texas population. That is a lot more prevalent than what I thought it would be. 25% of these cases in Texas are involved in sex trafficking, and this totals about 79,000 victims of youth and minors being sex trafficked in Texas alone. So whenever you sit there and think that they're not going to walk through your clinic doors, they more than likely are, because these victims are very prevalent in our area. So as the primary healthcare provider, what can you do? The biggest thing that you can do is to identify these victims. We can identify these victims through red flags. Some studies call them indicators. It's kind of an interchangeable word. So several references that I have listed here go over the red flags and the indicators. There's minor differences in each one of them, but for the most part, they're all pretty similar. There's not black and white in this. Your patient might not present like this at all, but these are common red flags to watch for. There's just a lot of gray area to remember. So this patient might have a very scripted or inconsistent history. They might be unwilling or hesitant to answer questions about their injury or illness. So those two kind of go together. You're asking them questions about why they're here. They can't really tell you why. Their story keeps changing. And by the end of it, you're just sitting there thinking that something really fishy is going on. They're usually accompanied by an individual who does not let them speak for themselves or have any privacy. I've seen this firsthand in the ER with a few of the cases that I've seen. So these people will be usually, if it's a female, accompanied by an older female who is presenting herself to you as her sister or her aunt or her cousin and is only speaking for her. Typically what this woman is somebody who's higher up in the chain of command in her sex trafficking ring and is basically keeping an eye out on this victim, making sure that she doesn't say the wrong things or do the wrong things to give her identity away. They usually will avoid eye contact and appear very fearful or nervous. This is a common thing that happens with many cases of abuse. They might demonstrate a hostile behavior and get mad whenever you're asking those personal questions. They may be unable to provide a home address, simply for the reason being that most of these people are homeless and they're just couch surfing and they don't have a physical home address. They're usually not aware of the location, date, or time because they're very sheltered by their captors. They're not usually in possession of any identification documents, so like they won't have their driver's license, their social security card, and typically the reason why is because these people are actually stripped of their identity whenever this happens. And usually they're not in control of money, so this is just another way for their captors to control them. The woman that's accompanying them will typically be in control of all the money. They won't have any for themselves, and that's basically just another tactic of control. So, what are some common reasons why you might see this person in your clinic? The most common reason is sexually transmitted infections. The reason why is because they're being exploited by several different people multiple times a week or day, and it's not like they're screening these people before they have sex with them, so they're going to come in for several different STDs at one moment. You might also see them for drug overdoses. This is a common one in the emergency department especially. I had a woman one time that we had a lot of red flags on and thought that possibly she was being trafficked, and she tested positive for 5 different types of drugs, and the ER doctor knew that there was no possible way that she ingested all of those on her own, and it was typically the reason being because she was being trafficked and drugged by her captors. This is another tactic that they use to control their victims. They'll get them addicted to drugs, and then the victim feels like they can't leave because that's their source of their drug and addiction. You might also see these people for pregnancy testing or abortion procedures, and typically these people do not seek care until their symptoms or illness are very, very far progressed. So they'll go in at the last possible second and you'll see them being very sick. So moving over to implications to APR in practice, basically, how do you apply this to your practice? As the healthcare provider, Be an advocate. You are sometimes the only contact with this person outside of the people exploiting them. So it is important to listen to them, believe their story, and basically just advocate for them. You also need to gather an appropriate assessment and history. So this might be that victim's only medical screening in the last several years and may be their only one for several years to come. So it's important to look them head to toe and look for things outside of what they're complaining about, just to make sure that you're covering all your bases, and then document very adequately afterwards. You also need to be very familiar with the red flags and indicators that I went over, and be ready to ask those uncomfortable questions. I know that I mentioned that these patients might be hostile when asked uncomfortable questions, but that's why it's important to build a good rapport with these patients, so they trust you and they feel like they're in an environment that they can speak about these uncomfortable things. So going off of that, it's important to promote a safe environment and let them know that you're here for them and no one else. You need to be able to recognize their body language, their affect, their attitude, and other indicators. So do they look uncomfortable when you're talking to them? Maybe ask, hey, why are you feeling uncomfortable? Build a better rapport with them going off of that. Set appropriate boundaries at the same time. So these patients are just like any other patient you encounter. You need to have appropriate boundaries the whole time that you're dealing with them. Don't forget to meet the patient's medical and psychological needs. So with all of this being said, don't get so wrapped up in the fact that this patient might be a victim of human trafficking that you forget to treat their actual reason why they're there. So don't get so wrapped up in figuring out if they are a victim of sex trafficking and forget to treat the STD that they came in for. That's a very important thing to remember. Since there are so many minors in Texas that do fall victim to sex trafficking, it's important as the APRN to also be familiar with the Texas Department of Family and Protective Services resources on child abuse and child safety. So there is a website that you can visit to make claims. It is mandatory in the state of Texas. If you have cause to believe that this person is a victim of abuse and they're a minor, it is mandatory to report it in the state of Texas. And as the provider, if you end up being wrong, it's not like you're going to get in trouble for it if you had reason to believe that something legitimate was happening. So I have also included in the middle section a few campaigns that are going on to end sex trafficking. These are good resources that you can provide your patient with because these resources offer more resources and a lot more opportunities for them to escape the ring that they're in. So the Blue campaign was a really neat one that I found. Their slogan is "One Voice, One Mission in Human Trafficking." So they were designed to teach the public, law enforcement, and industry partners to recognize red flags and indicators. So exactly what I am speaking about today. They're just raising awareness of the things to watch for, and they are actually funded by the U.S. Department of Homeland Security. So that foundation is doing a lot to end sex trafficking. There's also the Polaris Project. This was a really cool project that I found. It was developed to end trafficking. It provides client services, advocates for policy change, and education to the public. So they're actually like trying to actively make laws and change policies in order to help these victims. They operate the Human Trafficking National Hotline, which actually helped 23,000 victims in 2014. That is a lot of cases that they're helping every single day. So they're actively out there trying to provide these victims with freedom that they deserve. I've also included the Texas Abuse Hotline that goes through the Texas Department of Family and Protective Services, just as an easy resource right there. And then there's also, if people are uncomfortable with calling in and actually talking to a real human, there is a text line that they can also contact that can help them that way if they feel uncomfortable. So in conclusion, the secretive nature of this crime and the general lack of knowledge and awareness on the topic is a major barrier to identifying victims of sex trafficking. Almost every victim at some point in their captivity will have access to a healthcare setting, By raising awareness and educating healthcare workers that come into contact with these victims, steps are actively being taken to end sex trafficking forever. Each healthcare provider can make a difference by educating themselves on the red flags and indicators. Providers should be aware of the resources available to these victims, like the Blue Campaign and the Polaris Project. With the proper knowledge on this problem, there is hope that future victims will have access to the help that they need in order to escape slavery forever. Thank you.